Hi, this is Andreas Moritz, and this is in response to a question that I frequently received, and that is, how do you deal with a gallstone attack if it happens after eating a greasy, fatty meal? When a person has gallstones in the gallbladder or even in the bile ducts of the liver, then eating a fatty meal causes the gallbladder to release a fair amount of bile, and along with that bile, stones that may be contained in the gallbladder may come out. And during that, it may happen that one of those gallstones or several of them get stuck in the common bile duct and create what is known as a colic or gallstone attack, where the gallstone simply cannot move on, and the wall of the common bile duct starts contracting, and this can create an enormous amount of pain. I've had 40 such gallstone attacks before I did my first liver flush. I never had one ever again after that. So about 25 years ago, I started having gallstone attacks for about 10 years duration, until I figured out how to clean out my liver and gallbladder, release all the stones that impacted these bile ducts and the gallbladder. Totally, that was it. I passed about 3,500 stones. And once I cleaned out my liver and gallbladder, I never had any stones coming out of me. I did like 15 cleanses afterwards and never passed any other stones. And I've never had a problem ever since. So I would advise anyone who has gallstones and wants to avoid gallstone attacks to do a series of liver flushes until all stones are gone. However, if you haven't done that yet and you experience a gallstone attack, you may want to take some of these recommendations and apply them. So I would suggest, first of all, to drink a glass of Epsom salts on an empty stomach. Epsom salts has been shown to relax the bile ducts. There's a study that clearly showed when you take Epsom salts, like a tablespoon of Epsom salts in 1 glass, 8 ounces of water, you will dilate the common bile duct and the bile ducts in the liver, allowing any stone that may have been stuck in the common bile duct to pass on. The common bile duct is not just relaxed in response to taking the Epsom salt, which is magnesium sulfite, but also it will dilate according to the research. So the dilated common bile duct will allow any trapped stones to pass through, and this will stop the attack. This happens in 98% of the cases that I've seen and advised to take a glass of Epsom salt. So this is the first emergency thing to do when you have such an attack. The second thing I advise you to do is to drink the red beet juice during the next 2 or 3 meals. And it should be at least half a cup to 1 cup or even a little more of red beet juice taken during the meal, not after or before, but during the meal itself. And so that will also help to relax the bile ducts and allow the more bile to come through. Bile is very oily, and if there's a lot of bile coming through the system, then the stone has a chance to just move through the common bile duct quite easily. The third advice I would give is to make a poultice, take a flannel that is soaked in warm apple cider vinegar, or little hand towels So warm up apple cider vinegar, put that in, and then apply that right onto the liver area on the right side of the rib cage. And this will also relax the bile ducts and allow stones that are stuck there to pass. The fourth advice I would give is to massage the second and the second smallest toe on both feet. That means it's the fourth toe and also the third toe. So the third and fourth toe. If you massage these toes, there will be a relaxation of the gallbladder that will also help with the release of the stones that may be stuck in the cystic duct of the gallbladder or in the common bile duct. These are the most effective things we can do. Not every person who has a gallstone attack should immediately go to the emergency room, even though it's very painful. In 99% of the cases, this is unnecessary and can lead to unnecessary removals of the gallbladders, which is a real nuisance because that can cause severe gastrointestinal problems throughout the person's life. And again, it's totally unnecessary in the vast majority of cases that I've seen and know about. Thank you for listening, and anyone who has a gallbladder attack should follow this advice. First, taking a glass of Epsom salt is something that anyone can do almost right away, and that in most cases will work very, very, very quickly. Thank you.